The healthcare system in Gaza has been in significant decline since the beginning of the war, with aid groups calling for urgent action as shortages of food, water, medical supplies, fuel and shelter continue to plague the enclave. Well, for more, we're joined by cardiologist and Vice President of the Palestinian, Australian, New Zealand and Medical Association, Dr. Muntaser Musameh. Doctor, can you bring us up to date on the current healthcare situation right now in Gaza? Do we know how many hospitals remain standing and to what extent they are operational?
Thank you for having me on the program. The situation in the healthcare system in Gaza is completely dire. The whole system has collapsed. As we have seen the previous reports by the international experts, including Francesca Albanese and other experts, they describe the situation as medicide, which is a result of the systemic targeting of healthcare facilities. More than 38 hospitals have been attacked, ambulances, doctors, nurses, paramedics. Currently, is only very few, less than probably 7 or 8 hospitals are partially functional. We have teams from PANSMA on the ground, and they have described to us the lack of imaging facilities, the lack of operating theaters, medications, sterile, and a lot of things, even baby formula. So this situation exacerbates the suffering of the patients there, and there's complete obliteration of access to health, which is part of what was described recently by the independent inquiry commission by the United Nations, which described the situation as a genocide.
And how have staff numbers dropped since the start of the war? And those who remain, how are they able to cope? Describe for us the conditions they've had to work under.
The situations are very difficult because there has been reports of around 1,400, and those are numbers from 2-3 months ago, 1,400 healthcare workers who have been killed. There is also a number who have been injured or has left the Gaza Strip in the early days, but no one has been able to leave after that. So there has been a very significant attrition of healthcare staff, and the remaining staff has also been driven to the brink of collapse because they are starving. They also worried for their families who are not safe, and they have been working endless shifts. And also there is a big loss of a certain expertise. We have been through PANSMA and other healthcare organizations, aid organizations, been trying to provide some support and some relief for those healthcare workers. But so far the numbers are nowhere near what is needed to really be able to try and lift the healthcare system from where it is at the moment. And this situation, I don't think has happened ever in any previous conflicts since World War II or even before that.
If a ceasefire were agreed upon, how do you think that would change the situation in terms of healthcare?
I think this will be very important, but it will need an orchestrated governmental and healthcare organization and charities to all work in sync to try and bring in a lot more aid. We need a lot of more medical equipments. And I urge the Australian government to support us in PANSMA and also to try and provide help for field hospitals. We are embracing for a ceasefire. We are cautiously optimistic because we have seen situations where we thought things will happen and it didn't. But we're trying to prepare where we have a lot of volunteers who are ready to go. We do have at the moment a mission on the ground in Gaza, and one just left a few days ago.
Well, the WHO estimates nearly 42,000 people in Gaza are living with life-changing injuries from the conflict, including more than 10,000 children. So ongoing care is needed for these people, whether or not the war is brought to an end.
So that is a very, very true problem, because there's a lot of these people who have life-changing injuries who require either artificial limbs or require some reconstruction surgeries. None of those are available. And many of those children, imagine like when people require artificial limbs here in Australia, they get a lot of support and they have family support plus the social care and the healthcare system. But there we have many of those children, more than 10,000, as you mentioned, are the largest number of amputees in the world. Many of them, they don't have families around to support them. The healthcare system can't provide any of those things. Even wheelchairs or simple means of mobility aid is not available. So this will need to be addressed quickly as soon as we have a ceasefire, and we need large amounts of those things, and we need a large amount of probably mobile operating theaters and field hospitals to try and help those people with the amputations and injuries.
And how significant will the psychological impact and trauma be for those who have survived the war?
I think it will be enormous, and it will be long lasting. I don't think many people will be able to get out of it completely, because those insults have not only happened once, they have happened consistently over the 2 years. And people haven't been able to access any psychological support. There is no access to psychologists or psychiatrists to help with it. Plus, in Palestine and in Gaza specifically, the family bonding is very important to try and heal. However, many families have been completely destroyed, and some of those injured people have no surviving families. So this will also affect their healing, and I don't think many of them will be able to get over it.
And meanwhile, would there be an option for those needing specialist treatment outside Gaza? I understand there are more than 15,000 people in this position.
Yes, and I guess the true numbers are much larger. This is a large number, but we will need also to evacuate some people, because all the things that we talked about, rehabilitating the local hospitals and providing other healthcare facilities, still a large number of patients will not be able to access the surgeries and the procedures they need. And we are working on trying to see if we can evacuate some of those people to the neighboring countries, or try and bring some of them to Australia if possible, to receive those treatments, and then they can go back after they complete their treatments.
And just a final question, how widespread is polio right now compared to before the war? Is that a significant health concern?
There is an increasing numbers, but I don't have the exact figures for that. But as the lack of vaccination programs for children and the problems with the water sanitation and having access to clean water, the cases are likely to increase massively. And I'd like to mention one last issue quickly, is the women's health has also been under a lot of pressure, with a lot of pregnant women basically themselves are malnourished and lack any healthcare support. Many of them are now delivering at a very premature 30 weeks or 32 weeks sometimes via cesarean sections. And we have at one of the hospitals, they get delivered by cesarean sections that there is no neonatal ICU. They have to be transferred to another hospital, which is a half an hour away, in ambulances which are not prepared. I think we need the international community to work together. We need the Australian government, and we need all the public to help us really to be ready to try and move in, and also exert pressure to allow unhindered healthcare and aid into Gaza Strip. Otherwise, there'll be many, many more lives lost.
It's a really desperate situation. Dr. Muntaser Musameh, thanks so much for talking to us. Really appreciate your time.
Thank you very much.